Thank you for joining the American Association of Kidney Patients for our Advocacy, Skill, and Talent Development session. My name is Suzanne Ruff. I've been a freelance writer for the Charlotte Observer, published in Chicken Soup for the Soul books, and I'm the author of the nonfiction book, The Reluctant Donor. I am also a living kidney donor. My family has been affected by polycystic kidney disease for the past 75 years. Over 23 family members had or have kidney disease. The disease has taken the lives of 10 family members, including my mother. My sisters and my 3 cousins battle the disease now. I would not be standing here before you as a kidney donor if I hadn't witnessed the courage and the strength of those who went before me as they battled kidney disease. I am honored to serve the American Association of Kidney Patients as a member of the National Board of Directors. If you or a person you love is a kidney patient, I urge you to turn to AAKP. Become a member. It's free, and you'll make friends, and you will learn you are not alone. It is the best way to feel as if you have some control over kidney disease, because you really do when you are a part of AAKP. I have also been a co-investigator of a patient-centered outcomes research project, or PCORI as it is known, for the past 5 years. Our project is called Putting Patients at the Center of Kidney Care Transitions, or Prepare Now. Our next speaker will tell you about PCORI. Today, I am pleased to introduce Lisa Stewart, who will present on research training, how to collaborate with researchers and principal investigators. Ms. Lisa Stewart joins us from the Patient-Centered Outcomes Research Institute as a Senior Engagement Officer. AAKP has been a proud recipient of PCORI Engagement Awards and has also had representation on over 17 PCORI-funded kidney disease research projects to date. PCORI-funded studies elevate the value and importance of patient preference and patient-reported outcome data. By elevating patients as equal partners in kidney research, patients have a more direct role in influencing the options for their future treatment choices. It is now my pleasure to welcome Ms. Stewart.
Hello, and thank you for the warm introduction. I am very excited to join you today, although of course I wish I could be with you in person. I was asked to talk about the topic, how to prepare yourself for research collaboration. This is such an important topic and a timely one for us at PCORI because we just developed a new learning product that is for patients and other stakeholders. I will share information about it during this presentation. Before patient engagement in health research was the phenomenon that it is today, it was questioned what value could patients bring to the research enterprise. Because of a lot of hard work of patient advocacy groups like AAKP and other stakeholder organizations, the tide is changing. As more researchers gain experience with engaging stakeholders, and institutional and funding and regulatory forces are encouraging it through policies, there's been growing acceptance that indeed the very people who have the lived experience can and should be vital partners in research. So now, patients like yourself are being invited to take a seat at the table. But what happens when you receive the invitation? You might feel excitement or honored for being asked to represent your patient group. But some people may also feel very uncomfortable with the idea of being thrust into a whole new setting where they may not know anyone or understand the conversation. I think about this image on this slide. My yard doesn't look like this. For most of my life, I didn't have a yard. I may even have certain ideas about the people who for this setting is every day, what they like, or what they may not like. For people unaccustomed to working with scientists, it could be understandably daunting. Some patients have said when they join projects, they feel very nervous, unsure of how to navigate the experience because the language and research process are foreign. They sometimes feel alone and concerned if they are representing the ideas and interests of their fellow patients who aren't at the table. So in these few moments that we have together, I'm going to share what you can do to prepare yourself to take your seat. First, I'll start with an overview of different ways to engage, then take a close look at our exciting learning product that was just released called Research Fundamentals, and close with some key takeaway resources. This will be your to-go bag. A good place to start is by understanding that engagement with researchers can look and feel very different depending on the needs and resources of the study, the capacity of the team to engage, and the capacity of stakeholder partners to participate. There is no one size fits all. Here we see 4 types of engagement presented by their different degrees of intensity and levels of decision-making authority. Input are more one-time efforts. These will be circumstances in which you provide information or respond to questions in a focus group or a town hall or through crowdsourcing methods. Advisory roles refer to ongoing contributions that advisory groups make. This is when you're asked to sit on a stakeholder advisory committee, where you'll be having ongoing engagement with the team, providing input at key decision points. The collaboration level is exemplified through the roles of co-investigator and executive team positions. This is when you are part of the team that makes oversight decisions. And then there's the shared leadership level. This is where you may join the team as a co-principal investigator, where you have responsibility for leading and managing aspects of the study. Whether your role is an advisor, a co-I, or a co-PI, there are underlying principles that should guide all teams. PCORI's engagement principles are the ones of reciprocal relationships. This is where team members are mutually receiving benefit. Co-learning, where everyone is learning together. Partnership and trust, honesty, and transparency. You can use this information to get clarity on what you're being asked to do, what will be your role, what is expected of you, and how will that be shared. You can get clarity on who will be managing the engagement. Who do you know is the go-to person when you have questions or concerns? When something's not clear, ask questions. When surveyed, one of the chief challenges that patients raised was that they didn't understand if their contributions added value. Well, we think it's important for research partners to receive feedback on how their suggestions were used and the difference that it made. If this doesn't happen, you can certainly request it. But even before you start interacting with researchers, it's important for you to know the value you can bring to key aspects of a study. This chart shows findings from our research on engagement that shows the many meaningful differences that patient research partners are making and can make on studies. You should be aware of that through sharing your knowledge, you can help improve the acceptability of the study for research participants, the feasibility of the study so that it works well in real-world settings, the study quality, the relevance, meaning the study question and outcomes really matter to patients and will inform the decisions they face once the findings come in, as well as the engagement quality, understanding and contributing to the experience so that it actually is a positive one for everyone involved. Let me give you a real-world example here. Patient advisors in this scenario were asked to review the eligibility criteria and research design of a study. Because of their input, the research team expanded the eligibility criteria so it was more inclusive. They reduced the number of intervention sessions to limit the burden on patient participants. The study team at the end credited these changes that were made based on partner recommendations to increasing the overall participation and retention of study participants. This is just one example of how patients are making a difference. As you prepare to partner with researchers, it's helpful to know what challenges may lay ahead. This can help you sharpen your radar and, most importantly, work with the study team at the onset to design preventive measures. Taken from a PCORI survey, common challenges that patients cited in their experience with working with researchers include knowing their value, as we discussed previously, feeling like they're being heard. This can tie into knowing your value, but it also can be about the dynamics of how meetings are conducted. Remember the dinner table example? There are situations where you may not feel like you're being recognized for talking or that there's dominant voices at the table. Sometimes it can be exhausting to push through to be heard, and sometimes confidence can get low. A good meeting facilitator can help address some of these issues. Other issues that were cited in this survey included feeling connected to others on the team. For this, you could share ideas for building connection and keeping information open and moving throughout the group. There's also issues around managing expectations about project delays and understanding jargon. This is really about understanding the research world, which we'll get to next. Lastly, there are challenges that are shared by both researchers and research partners. Many of those are logistical in nature. For the patient partner, we would ask you and hope you would feel comfortable with being honest about your scheduling, technology, transportation, or caregiver needs, and ask for support in overcoming these barriers. Key takeaways are: be confident in your value, request feedback, work with the engagement coordinator, the person assigned to manage engagement activities, to proactively address the possibility of these challenges. Gain familiarity with the techniques for working on teams, gain familiarity with the research process, methods, and terminology, and hold teams accountable to maintaining the principles and standards of engagement. Few patients and consumers who are invited to work with researchers on the design of research have any related experience. The culture of research, the processes, the language, the norms, and how they fit within this are all very new. PCORI just released last month the first of two training tools to help meet the needs of multi-stakeholder teams. It is called Research Fundamentals. The goal of Research Fundamentals learning package is to provide foundational knowledge to non-scientist stakeholder partners in patient-centered outcomes research, comparative effectiveness research, and the research process. You can think of this as Research 101 for non-scientists who may want to learn the basics of the research process so they feel more confident in engaging on a research project. The second learning package we have in progress, entitled Building Effective Multi-Stakeholder Research Teams, is being designed to provide training and resources to entire research teams to build skills and behaviors to work together successfully. This package will be available toward the end of 2020. Both of these tools are being designed to be self-paced and meet the needs of stakeholder partners. I also want to note that they are free, will be free, and publicly available on PCORI's website for anyone to use. I'm going to spend time in this section of the presentation to go over the structure and content of this package and the ways in which it presents technical information that is common in research. Research Fundamentals was developed with stakeholder input. Along the way, our stakeholder advisory group advised on content, and they also did extensive iterative testing of modules. We used an evidence-based approach to the development, which addresses varied adult learning styles. This slide shows you the structure of the learning package. There's a navigation tool to help the user explore the content and identify the modules that would be of most interest. There's an interactive PDF that explains PCORI's origins and the basics of PCOR and how it is distinguished from traditional research. It can be downloaded and easily shared. The video-based modules is a series of videos with PIs and stakeholders discussing their experience with engagement as well as benefits and challenges. And then there are a series of 5 modules organized around the stages of the research process, from developing research questions all the way through to sharing research. As noted previously, users can access any content on an as-needed basis. So while a user may choose to start from the beginning and complete the entire package from beginning to end, he or she may also simply choose a module or even a section of a module to access the content as he or she needs. While there are a number of modules, we strive to keep them to a reasonable amount of time to complete, not more than 30 minutes. So now I'll show you just a few screen grabs to give you a sense of the look and feel of the learning package, and to show you some of the methods we employ to help make the content more accessible to non-researcher partners. This image is in Module 1 on developing research questions and shows a stakeholder voicing a question she would want answered by a research study. You can see here the various means by which the user can access information. In the top right, there's a link to the menu that allows the user to navigate any topic within the module. There's also a link to the glossary. The transcript link allows the user to read a transcript of the audio content. On this page, you see other features for user navigation. At the top right, under the menu and transcript links, you see quick access links to the 3 main sections of this particular module. At the bottom of the page, a progress bar shows the progress of the voiceover narration, and the user can move forward and back using buttons to the right. This is a screenshot from Module 2, which has a patient partner guide that talks the user through all of the content. You can see here, he's informing the user that Module 2 focuses on designing a research study, specifically choosing a research method before then launching into descriptions of various research methods. This slide shows you a still from an animation that helps explain a scientific concept. In this case, is providing a visualization to accompany the narration describing prospective observational studies. The next set of slides are from Module 4, which is on sampling, recruitment, and retention. It demonstrates the concepts of an inclusion and exclusion criteria, which are important parameters that determine who can participate in studies. In pragmatic studies, you're trying to replicate real-world scenarios, so are aiming for minimally restrictive exclusion criteria. As you can see here, these are all women who have had breast cancer. And here, this image represents that the team has identified 2 exclusion criteria that include women who live far from a screening site and those who have had breast cancer 2 or more times. Within the modules, there are knowledge checks. And this slide shows you an example of what they may look like. They are used throughout in order to help the user gauge his or her understanding of key concepts and to reinforce content with users. This one from Module 4 recaps to the user that bigger isn't always better when it comes to sample size. And finally, this screenshot is from Module 5 on understanding and sharing research findings. It shows how PCORI can be taken up into practice by various stakeholder groups, in this case, a health system. Ultimately, we want research to shape care and policies. By the end of the year, we will release our second learning package, which will be called Building Effective Multi-Stakeholder Research Teams. As noted earlier, new and experienced researchers and stakeholder partners will benefit from this package. It offers practical guidance on developing the skills and behaviors that are needed to work successfully as a unified team. This learning package will be a multimedia website with content and resources on some of the thorniest issues in multi-stakeholder teamwork, including addressing bias and exclusion, establishing and maintaining trust, sharing a vision among PCORI team members, creating an inclusive team and culture, cross-cultural communication, and addressing common challenges with stakeholder engagement. So as we close, I want to leave you with several resources. Now I leave you with a few tips for preparing for a successful collaboration with researchers. Again, be confident in the value that you bring. Remember, your contribution helps to make research reflect the needs and values of patients. That your contributions can improve the feasibility of doing studies in real-world settings, and improve the relevance and encourage uptake and use of research results. Request documentation that defines your role and your work on the team. You could create them together if they don't already exist. These are documents like memorandum of understandings and charters and job descriptions, as well as timelines and roadmaps, so you understand key points along the process. Seek support for overcoming logistical and technical barriers that may limit your participation. Develop familiarity with key terms and concepts via learning packages like Research Fundamentals. Network with other research partners. Reinforce PCORI engagement principles. And always, always ask questions, lots of questions. To the right, you'll see a sampling of questions that you could ask of your engagement coordinator or study team. In addition to Research Fundamentals, PCORI has created a number of other engagement resources that are shown here. These are all available on our website in the engagement resources area. A foundational tool that's used by researchers as well as partners is our engagement rubric. And this provides a framework for thinking through where and how you can engage. And also available is the Engagement and Health Research Literature Explorer. This is a searchable database of publications about engagement and research. It contains over 1,000 articles that are available to you for use. There's also the Engagement Tool and Resource Repository. This is a repository of tools and resources developed through PCORI funded projects. Here you would find examples of MOUs or charters and job descriptions, as well as other useful tools to help you with engaging. And in closing, I want to encourage you to think about joining PCORI's Ambassador Program. Remember previously where I said it would be helpful to network with other patient partners? The Ambassador Program provides such an opportunity. There are workshops and conversations that are occurring on a regular basis with and among ambassadors. You'll see here at this slide someone who is very dear to PCORI, David White, who was the previous past chair of our Patient Engagement Advisory Panel, and also a member of AAKP. Well, I hope you gained from this presentation some tips about how to prepare yourself to engage with researchers, as well as awareness of where there are research tools, engagement tools that can help you in partnering with researchers. Should you have additional questions, please feel free to reach out to me. I wish you well on your engagement journeys. Thank you.
Thank you, Ms. Stewart, for an excellent presentation. On behalf of AAKP, we appreciate you and the PCORI team for your ongoing partnership with AAKP and for your time today, along with the valuable information you shared. Thank you.